Hello again, I'm Dr. Wendy, aka Dr. Every Woman, and we're taking off the white coat. All right, white coat is still off. I want to talk about how I manage fibroids beyond like hysteroscopic removal of small fibroids or polyps that are inside of the cavity of the uterus. Say they're in the wall of the uterus and they're a little bit bigger. You can either do a few options. Usually if they're under about 10 centimeters and you haven't had other procedures before, you can have either a laparoscopic or robotic myomectomy if we're talking about removal. Laparoscopic or robotic myomectomies can be done typically for fibroids that are under 10 centimeters and for people who haven't had a whole lot of other abdominal surgeries to have a lot of scar tissue. If fibroids are bigger than that, they may need an abdominal surgery like a C-section incision to really get in there and take out as many as possible. Embolization is also a procedure that can be used to shrink fibroids. So uterine fibroid embolization is done through interventional radiology, where they, while you're under sedation, go into some of your major veins, either in your arm or in your groin, and feed these little beads into your uterine arteries. And they usually try to find the big fibroids and they cut off the blood supply to them. And that causes something called an ischemic necrosis. Ischemic necrosis is a cell death or a fibroid death that's going to occur over the course of usually days to weeks. That can be kind of painful, but it also can shrink fibroids pretty substantially without needing a major surgery. Similarly, a procedure called radiofrequency ablation of fibroids can be done either by a gynecologist, either through the uterus hysteroscopically or laparoscopically. There's two different devices that do that. And what we do is we take an electrically charged probe and we kind of skewer the fibroid, we kind of slam it, okay? And we heat it up to cell destruction. And that's called coagulative necrosis. So coagulative necrosis is another way to essentially cause cell death, destroy those cells, and then they shrink as well. So fibroids with either embolization or radiofrequency ablation will shrink by about 30%. So think about a fibroid that is 10 centimeters. It's not a great example, but go with it just for the math. 10 centimeter fibroid is about the size of a softball. Shrinking that by 30% is going to bring it down to about 7 centimeters, so about the size of an apple. So still there, still not small, hopefully softer, but again, didn't require a big major surgery. I like to do those procedures for people who have fibroids that are usually about 5 or less centimeters. So 3 to 5 centimeter fibroids are going to shrink down more substantially, where the patient's usually going to notice some relief, not only from the pressure of fibroids, but from the bleeding that's caused by fibroids. So stay tuned, more to come, and also please visit your local friendly gynecologist.